And I want to wish everybody a very good morning and to welcome you all to our special AARP Coffee and Conversation. I am your host, Mary Roberge, and I volunteer with AARP New Hampshire. And also working with me this morning is Bev Cotton, who is another AARP volunteer. So please note that we are recording today's session. Before we do get started, I would like to cover a few housekeeping items. In an effort to eliminate any background noise, please be sure to mute your line by ensuring that your microphone icon has a line through it. We do want to hear from you this morning. So if you do want to ask a question, please use the chat box, which can be accessed by clicking the chat button at the bottom of your screen. Bev will be checking throughout the program and raising your questions. Here at AARP New Hampshire, we are focused on the health and the financial security and social connections that are critical to the well-being of the 50 plus in the Granite State. We carry out our work through targeted advocacy at the state and federal levels, compelling engagement of the 50 plus community statewide, and also serving as a trusted resource for information for our members and the public. Joining our conversation this morning is Lisa Mcnamay. She is a Medicare specialist with the Hillsborough County ServiceLink. Lisa moved to New Hampshire in the 1990s to be closer to family. She has been with ServiceLink in Hillsborough County's Nashua office, where she answers requests for information and referrals for non-medical services since January of 2014. Most of the time has been spent as a SHIP certified Medicare counselor. Lisa brings with her a wealth of experience as she has worked for a large health insurance company. Good morning, Lisa, and welcome. Thank you so much for joining us this morning.
Good morning, Mary. How is everyone? Good.
Lisa, so your bio mentions that you are a SHIP certified Medicare counselor. Can you please explain what SHIP stands for and share a little bit more about what it is that you do?
Sure. SHIP stands for State Health Insurance Assistance Program. Basically what it is, it's Medicare specific. And basically what it is mostly for people who are new to Medicare or trying to find a new drug plan or Medicare Advantage plan. We help those people out. We kind of help you navigate the waters and answer your questions as best we can.
Do we have any questions in the chat regarding a SHIP counselor?
Nothing yet.
Okay, thank you. So Lisa, can you tell us a little bit more about ServiceLink and what it is that you do and what free services are available to people who are looking at their Medicare options?
Certainly. ServiceLink is an aging and disability resource center. So we do Medicare. We're Medicare specific. We're also very long-term care options specific. We help people and their families kind of navigate those waters as well with what the state offers in terms of in-home care or nursing facility care. And, what might be best. We give you the information, whether it's long-term care options or Medicare, we give you the information that you need in order to make the best decision you can for yourself. That's basically what it is. And then, of course, there are always the referrals for, non-medical transportation, help around the house, that kind of thing. People call us for everything. And I will tell you, in the wintertime, they call us for somebody to come shovel their walk or their driveway. Unfortunately, in Nashua, that just doesn't exist anymore. I don't know why.
So basically, you don't make decisions for people. You just are a referrals and information service.
Yeah, essentially, Mary. We're unpaid. You do not pay us. And that's how you get the unbiased opinion. or not even opinion, but information. You know, we'll never tell you this will work better for you, because frankly, I don't know what's going to work best for me in a few years. I don't, and I know my health. And basically that's what I would say. Take a look at your health, your history. Which way then would be a better way to be covered, by a Medicare Advantage plan that includes drug coverage, or by a Medigap policy, which picks up the 20% that Medicare does not, plus a few other things like inpatient deductible, which is almost $1,500 per benefit period. And then adding on a separate drug plan to that. I mean, you know, then you're the only one who can decide what will work best for you.
So because each plan is, or Medicare decision is specific to each individual. What you're saying, or from what I'm hearing, is people also need to take into consideration not only what works best for them, but also the costs that are involved.
Absolutely. Absolutely. Sometimes people will go with a Medicare Advantage plan because the premiums usually are at zero. And that's attractive. You know, and they think, well, gee, you know, my health has not been bad, and I don't expect, there isn't anything in the family that I'm expecting to rear its, you know, ugly head in 10 or 20 years. I'm pretty healthy. I think I'll try out a Medicare Advantage plan, and that's fine. You know, when you're making that decision between Medigap and Medicare Advantage, it's kind of a pay me now or pay me later situation. With Medigap, you pay a monthly premium, and it's usually $100 or more. Depends on the company, depends on the plan. Where the Medicare Advantage are zero. However, this year, you can actually have on a lot of the plans, you can have an out-of-pocket maximum of $7,500. And that's way more than 12 times your premium for a Medigap plan. So, you know, if your health is really good and you think it's going to stay that way, Medicare Advantage with drug coverage, not a bad way to go. If you know you have, you know, a couple of strikes against you with chronic conditions, Medigap with a drug plan, not a bad way to go.
Mary, we have a few questions.
Okay.
First off, how do folks reach you? And secondly, well, and I've got more. Secondly, is there any regional consideration for where people live as to what ServiceLink office they call?
There may be slight differences among service links. I would say in terms of Medicare, though, the biggest difference is that Medicare Advantage plans are county specific. So the Medicare Advantage plans available in Hillsborough County may or may not be available in Rockingham County, for instance, and vice versa. Now, reaching me, you can reach me personally at the Nashua office at 598-4709. We also have a Manchester office, and you can reach them at 644-2240.
So
644-2240.
okay. And there is also a toll-free number for people in other counties of the state. Am I correct, Lisa?
Yeah, there is. I'm actually looking around because I don't know it off the top of my head, and I'm looking for something that might have it on it.
While you're looking, I have another question. Why doesn't AARP/United Healthcare Medicare Supplement have silver sneakers in New Hampshire?
Good question. That is the type of question that we would refer the client to the actual insurer, because it's their decision, actually. And I don't know why they wouldn't offer it up here. I mean, that's a very popular program.
Sure is. And plus it would seem like it would keep people a little healthier longer. So in the long run, it would be a smart thing for an insurance company to do.
Right.
There's someone that would like us to explain a little bit more about what do you mean that Medicare Advantage is county specific?
That means that the plans in Hillsborough County are not exactly the same necessarily as it would be in any other county in the state. And works the same way in each of the counties. I mean, COAS, they might have exactly what we have. They might not, and vice versa. But I mean, we had 30-something Medicare Advantage plans this year, so it's not like there are too few. It's just they're different.
What
That's all.
happens when a person, say, for an example, has been getting a Medicare supplement gap for a few years because they were just coming off an illness and weren't sure what their needs were going to be, but then they want to switch to an Advantage plan? Do they have any problem switching back and forth between traditional supplements and Advantage plans?
No, and yes, I am hesitating. If you've got a Medigap plan and you say, gee, I want to try out a Medicare Advantage plan, and this is the very first time that you've tried a Medicare Advantage plan, no problem. And you can go on that Medicare Advantage plan as long as you make your choice whether to stay with or go back to Medigap within 12 months. You can go back to Medigap. The company that you go with may not offer the same plan, but I'm sure somebody will be able to help you out. If it's the second Medicare Advantage plan that you've had, well, you can still go back to Medigap. The difference is they can charge you more and they will consider your pre-existing conditions. And that can be a big deal.
And then there was a question, are some of the Medicare supplement options being phased out?
Plan F as in Frank and C as in Charlie. Anyone who turned 65 after January 1st, 2020 is not able to enroll or buy one of those policies. So for instance, I turned 65 in 2018. If I wanted to, when I retire, I certainly could go for Plan F or Plan C. Do I want to? I'm not sure. This is where it gets into as the pool of insured people shrinks, what happens? Well, prices go up, costs go up. The insurers say no, which we expected, right? Again, it's entirely up to you. That's a choice you make.
Right. And that's an important factor too to consider because premiums do go up yearly. Am I correct?
Yeah, they do. The first year when you buy it, it's based on your age. That's the only time it's based on your age. After that, they'll find whatever reasons they need to increase the premiums. Because insurance companies.
So for everyone, I did get the toll-free ServiceLink number, which I did put in the chat.
Thank you, Mary.
It's 1-866-634-9412.
Thank you.
Okay. So I just wanted to also talk a little bit about the upcoming open enrollment that begins on October 15th. Can you explain a little bit to everybody what open enrollment is? I'm sure a lot of us do know, but for those who have any questions?
Sure, be happy to. That is your opportunity to, if you've got just a straight prescription drug plan, not a Medicare Advantage, but just a prescription drug plan, you can look at the available plans for next year. Would you always want to do that? Maybe, just to see what's out there for next year that maybe might fit you better. How you would make that determination, as to whether you do want to look, even if you're happy with your plan. Every year in September, as a matter of fact, every insurance company sends an annual notice of change. And that will tell you exactly what's changing, your premium, any coverages, how things are covered. It's a really important thing that, you know what, most people say, oh yeah, I don't need that. You know, and then are sometimes surprised that their premium has doubled, you know, and that's pretty awful. You can also, if you have a Medicare Advantage plan, do the same thing. Take a look around, see what's being offered for the following year. And if it looks like it'll fit you better, no problem, just go ahead and enroll. You can drop your Medicare Advantage and go back to original Medicare, which is A and B plus a Medigap plus a Part D plan. But, you know, mostly it's for, you know, getting a new Medicare Advantage plan or a new drug plan, seeing if there's something that works better for you.
Is this something that ServiceLink can help people with if they have questions?
Absolutely. Unfortunately, we're not seeing people again this year. We haven't seen anyone since a year ago, March, really. We did all of it on the phone last year, and there was a big drop off. You know, I'm going to tell you, just call. And if we can help you, we will help you. If you want to go to the plan finder now and take a look and get used to it, don't let yourself get frustrated. Call me. I'm happy to help you. And that will give you an idea of what you're looking for and what we would help you look at, actually. Probably the best thing you can do, though, before that, is to actually create your account for yourself at Medicare.gov. You'll need your Medicare number to do that. And then you'll keep the username and password in a safe place because you're the only one who's going to know it. But once you call us and you want help, you obviously are giving us permission to sign on to your account. And we're happy to do that and to help you and to see where you might be not, you know, getting the idea or it's not working for you.
Okay, and I'm not sure, I'm thinking that everybody on this call is aware of what the plan finder is, but can you just briefly explain?
Sure. Basically, when you sign on to the plan finder, you tell it what you're looking for. Are you looking for a Part D plan? Are you looking for a Medicare Advantage plan? And you make that selection. You go and you add in your prescription drugs. You're going to need the name, the strength, and when you pick them up at the local pharmacy, how many you get. So you might be on 1.5 pills, 5 milligram pills of lisinopril, let's say. So you would get 45 in a month. Or if you get it every 3 months, you get 135 in a 3-month period. It will, once you've finished adding in all your prescription drugs, it will ask you what pharmacy you use. You can actually compare up to 5 pharmacies. And in there, you can include mail order pharmacy if that's something you want to try. Mail order used to always be less expensive. That's not the case all the time anymore. So it's good to do local and mail order. The other thing to look for in the pharmacies is when you get the comparison back is to look for the ones that are preferred in network pharmacies. That's where you will get the best price. There are in-network pharmacies as well. You'll just pay a little bit more. And you know what? Some people say, hey, that's been my pharmacy for 30 years. I don't care if they're in network and if they're preferred. You know, everything's choice.
Thank you. Bev, do we have any additional questions in the chat?
Yes, there's one more, and it says, once you choose a plan, do you have to stick with that plan for a year?
For the Medicare Advantage, you can actually, and this is pretty new, you can actually go ahead and change it in the first 3 months of the year. That's called the Medicare Advantage Open Enrollment or annual enrollment. If you decide that this plan is just not going to work for you, you can do that at that point in time.
And one more question, is Medicare Advantage restricted to only their network doctors, specialists, et cetera?
Well, yeah, you know what? Just like the regular employer group plans, if you have an HMO and that doctor that you use is not in the network, that basically the cost will all fall to you. So if all of your doctors, all of your facilities are in network for that plan, you're fine. If they're not, I mean, and that's the doctor's decision whether or not, it's all based on their contract and how much they get paid. If you are in an HMO PPO or just a straight PPO, which is a preferred provider organization, then you have out-of-network benefits. So it may not matter too much to you. You will pay more, but you'll be covered.
I think that's it for now.
Great. Wow, there's a lot of things that have to be considered, and so many different time frames. Sometimes it can get confusing to people if they're new to what open enrollment is, and also just to initially enroll in Medicare.
I do have one more question, Mary, and that is, what do you think about GoodRx? And I'm very curious as to where they get their funding from.
Oh gosh, I don't know where they get their funding from. I will tell you that GoodRx, like any of those type of services, if you go on and you check for your medication and you see how much it is and it's still way too expensive, go somewhere else and call ServiceLink. I mean, there are places that will help you. There's actually something called the PAN Foundation, and I don't know what PAN is, prescription assistance. I don't know. But in any event, I think it's pan.org. And they actually kind of warehouse all of the grants that are available to cover the drugs for certain medications. Usually the really expensive ones, like the injectables for arthritis and so on. But I don't know, nothing beats coverage. And if you don't take anything, what I would say to you is what I say to everyone. If you are not on a monthly maintenance medication, go for the cheapest premium. And if you don't have to use it, if it's like $4 at Walmart or somewhere else, pay the $4. Yeah, you'll never hit the deductible, but you probably wouldn't anyway if you're not taking too much or anything at all. So it's a consideration.
So basically, you're saying that even though you don't take any medications, to sign up for a prescription drug plan. And what is the other advantage to doing that?
Well, if you do not enroll when you first can, or if you decide, you know what, why am I paying this premium every month? And you subsequently you drop a plan. When you do go back, and you probably will, because we're all going to need medication at some point in our lives, or most of us anyway, you will pay a penalty, and you will pay it with your premium every single month, forever. And there's just no reason to do that. It's not as onerous as the Part B, as in boy penalty, but it's still there. And if it were my situation, it would aggravate me every single month when I paid the premium.
So you mentioned a few service, oh, I'm sorry, go ahead. Oh. Okay, you had mentioned a few services, of the free services that ServiceLink provides in addition to assisting people with questions that they have on Medicare and also, Medicare Advantage and prescription drug plug. Are there any other things that ServiceLink can assist the people with?
There are, basic, and we don't do this too much anymore just because the call hasn't come up for it very often, but we will help people fill out applications and, various types of paperwork. Most often it's the application, for instance, for help paying for Part B with the state. People come to us, we help them. Sometimes it's just, you know what, it's too much for me. Okay, we'll help you. I mean, now we'll help you over the phone, but, and that's something that we used to do an awful lot of that, an awful lot. And we'll help you apply for Social Security extra help for your drug plan if you're below a certain income level and asset level. Basically, Mary, I'll tell you something. If you call and you ask us, we'll probably do it. Within reason, we'll probably, try to accommodate.
Okay. Good to know. Thank you. Viv, do we have any other additional questions?
I don't see anything right now. No, thank you.
Oh, great. Thank you so much. So thank you, Lisa.
Well, thank you. Thank you everybody for your time and your questions.
Yeah, we really appreciate you. I'm sorry, go ahead. Oh, I thought somebody.
There is, what is the ServiceLink connection call in Massachusetts? Do they have a like organization in Mass?
Yeah, SHIP is actually a nationwide program. And in Massachusetts, it's actually called SHINE.
SHINE.
Yeah, and it's part of the Commonwealth's government.
Good. Okay. Well, again, Lisa, I do want to thank you for sharing your time and your expertise with us today. I have found it helpful, and I do hope that our audience did also. I want to thank our audience for joining us for today's coffee and conversation. And I hope that you enjoyed hearing from Lisa. And the toll-free number for ServiceLink is in the chat. And Lisa, with all the information and the resources that can be of value to you. And I also want to ask that you check the AARP New Hampshire website often at aarp.org/NH for more virtual programs that are coming soon, including our live cooking demonstrations, our paint and sip events, gentle yoga, and we do have more coffee and conversations. And
we have a couple more. We have another quick question. What do you recommend for vision and dental?
Not allowed to recommend, but you certainly can call Delta Dental, see if Anthem has a standalone program, or any of the carriers really. VSP for vision, they've been around forever. Delta Dental also has some kind of a vision tie-in, and when I had it myself as an individual, I never used it because I thought, vision, really? But I would probably go for any of the usual suspects, all the carriers, and VSP on vision.
Thank you. And Mary, I assume the recording is going to be posted into the portal?
No, usually our recordings are posted on the aarp.org/New Hampshire website. So it will be of a resource for other people. And I do have still, I think, the ServiceLink number, which is 1-866-634-9412. And you can also get that phone number on their website. Lisa, again, thank you so much for joining us today and for all sharing your knowledge with us regarding Medicare.
Oh, you're very welcome, and I was happy to do it.
Great.
Yeah.
Thank you. Thank you so much.
Have a
Bye-bye.
good day, everyone.